Every day is a battle and it's a challenge, and every day I do actually think, every day I actually think I don't want to die.
In the past 3 weeks, Dr Rita Al-Mahdi has treated dozens of people who could be carrying coronavirus.
As of last week, I've moved my chair to the door. I've left the door open and I've added this fan so it's blowing the air out of the door. You still have to examine some people sometimes. That's where the danger comes in, because your mask is 5 days old. It's a very anxious time and a worry, really.
And there's already been one confirmed case of coronavirus diagnosed here at Dr Al-Mahdi's clinic.
The doctor who saw this patient had to go into isolation. He tested negative, thankfully, and then came back to work, but now he's reduced his days because obviously he's worried. And my other colleagues have reduced their days because it's a real risk for us.
Here in Australia, more and more GPs are testing positive, and cases of medical staff self-isolating with symptoms are on the rise. Coronavirus is taking down healthcare workers around the world every day, some of them describing this pandemic as war. And these doctors and nurses are the brave soldiers on the front lines. Some hospitals in Europe are on the brink of collapse. Almost 10,000 medical workers in Spain have tested positive for coronavirus. In France, a public hospital has 490 infected staff, and at least 50 Italian doctors are now dead.
It just makes me very sad, and I just, I take my hat off to those doctors in Italy that are going through that at the moment.
Doesn't that scare the hell out of you?
Yeah, it's been quite terrifying, and you're not always 100%, even with protective clothing. I've been sitting like that and touching my face, and we've all been told don't touch your face. So, as much as you can minimise risk, there's never no risk, and even the best of us, slip up. So,
what are you struggling with the most at the moment?
It's kind of been hell on earth, really. Seeing these people, and just by the sheer statistics, that some of them do have coronavirus, but you can't test as aggressively as you'd like to because we just don't have enough testing kits. So we're working pretty much from the beginning of the crisis with little equipment. We're using gowns that are meant to be single-use gowns for over a week.
Does that mean you're not protected when you're working?
Yeah, exactly. And it's not good infection control because who knows what's on my gown.
Which doctor do you want to see?
So you're coming into my room?
4 o'clock.
There's a lot more abuse in the practice that we're experiencing. Their anxiety and fear is palpable, and people's tempers are becoming short. We're getting all these new patients coming into our clinic and not saying that they've got a cough or cold.
So they're not disclosing that they have symptoms?
No, because they've been turned away from their usual GP. They don't want to be turned away again, so they want to see someone because they're frightened, so they don't tell the secretaries that they have respiratory symptoms. And then they come into my room with a cough or cold and, sit next to me.
Do you feel like you're putting your life at risk by going to work every day?
Yeah, I do. And I've got a 2.5-year-old. I'm a single mum, and I'm also 6 months pregnant, so I've got to worry about the unborn baby as well.
You're pregnant? That's got to be a tough call to make when you get up every morning and say,
yeah, I mean,
do I put my family at risk and my unborn child, or do I go to work and try and save some lives?
Yeah, absolutely. It's not just every morning; it's throughout the day as well. I think about it. So, yeah, that is, yeah. But I just keep going, really. It's kind of my job, and I want to help people. If all the medical stuff ran away, then everyone would get sick.
But you're pregnant.
Yeah, maybe some people would call it reckless.
I don't think it's reckless. I think you're a bit of a hero, to be honest.
My mum is a doctor.
When you put your head down at night to try and go to bed, what are you feeling in those moments?
I don't want to die, and am I doing the wrong thing? And yeah, when should I stop working, really?
Mommy, this is a big snowman, and this is a baby snowman, and this is part of snowman.
Yes. That's when it kind of hits home, and that's when my mortality becomes quite real, when I just, sit quietly on my own. There's, thoughts about myself dying and who's going to look after my children.
This is my mummy.
This is my mummy.
Because this is uncharted territory, and how we're all going to cope, and the inevitable, loss that we're all going to have.
I guess it's really not often that we hear doctors speak so freely or so openly about what they're actually feeling, right? Because your job is to look after everyone else. But
The vulnerable doctor.
is that what we call you now, the vulnerable doctor?
No, I'm strong. As my 2.5-year-old would say, I'm strong.
I'm strong.
I love you.
I love you, Mummy.
Rita, what do you need to feel better right now?
Protective clothing and more rapid testing and the masks,
As a doctor, what's your advice to our government in this crisis?
To maybe listen to the ordinary doctor and what we're going through, not just the bureaucratic doctors that aren't on the front line. I just want to wish all my colleagues strength and courage, and please look after yourself and stay safe.
We've seen thousands of people almost ignoring social distancing measures. What's your message to those people that seemingly aren't taking it seriously still?
This isn't a joke. People are dying. If you look at what's happening overseas, it's real. And you don't want to hear the news that your friend's died, or your cousin or your father or mother in ICU. Stay indoors as much as you can. Wash your hands, wear your mask, and just keep that 1.5 metres, 2 metres away from people. It's just not worth the risk. And that way you'll save lives. Your life and other people's lives, Just please do that.
It is amazing stuff there, guys. The healthcare workers in this country are truly incredible. They risk their own safety to protect ours, but I think it's important that although we thank them now so much, we have to recognise that they don't do this just now. They do this day in, day out, year in, year out. And so that should be our attitudes towards our healthcare workers all the time. We should make sure we thank them now, but always respect your nurses, your doctors, your ambos, and treat them like the heroes they are year round.
Beautifully said, and they are human beings, right? They take an oath, but then we get hit by something unprecedented like this, that, they're doing what they always do, but now they're doing it on a scale, aren't they, where we're really noticing it,
But also those figures we just heard, 10,000 medical professionals are infected in Spain. 50 Italian doctors are dead.
And I think it's so important to remember, as you said, PVO, these are people who have families. This is Dr. Rita is a single mum who is pregnant and still putting her life on the line. The least that all of us can do is to stay home and to be respectful to our medical professionals, and for the government to be listening to everyday doctors. I think that's so important.
That was such a good point that she made, not just the bureaucrat doctors, but also the doctors on the front line.
Yeah.